Have you recently had a hip replacement and now you are done with the physical therapy, whether that was in your home or in a clinic for a few weeks, and you are just ready to take it to the next level to get back to doing all those things that you need to do in life and some of those things that you used to remember doing? Then stay tuned for an exercise program that I've designed specifically for you to get you back to doing all those things you need to do. It seems like I'm running into more and more people all the time having to have this hip replacement done at earlier ages. Now, maybe that's just because I'm getting older and older, but seriously, I do think that people are having to have that hip replacement done earlier than what it ever used to be in the past. And I don't think that's because it's overused. I do believe, though, that it's because we've just been more active. Some of us have been doing sports since we were 5 and 6 years old, and we've just done a lot to our hips and knees. So there's a lot of wear and tear, a lot of degeneration, which just leads to having that. Some of us will have to have that hip replacement done earlier than what it ever used to be done. What is pretty typical is that your doctor will order some physical therapy, whether that's in your home or you go to see a physical therapist, and that's done for a few weeks, maybe even 4 or 5 weeks. But when you're done with that, you're told to just continue with the exercises. But what I'm hearing from people is that those exercises then just get a little too easy, and they just aren't sure what to do. They know they're not quite ready. They don't have the strength that they need to get back to doing some of those things that they used to do before they started having hip pain and before they had this replacement. But they're just not sure what to do. So I've designed this program for you with 5 exercises that will work on your strength, get you stronger, get your balance better, and get you back to doing a lot of those things that you just need to do and want to do. This program is not meant to replace what your doctor has ordered. So if your doctor has ordered some physical therapy, you've just had that hip replacement, then you do need to go and see a physical therapist. You need specific exercises that they can give you, and your therapist is also just going to be able to give you lots of good information and answer a whole lot of questions in that beginning phase of after this hip replacement. So make sure if your doctor has ordered physical therapy that you do go and see that therapist, and then you can come back to this program when you're all done with that. If you try this exercise program but you can't perform some of the exercises or all the exercises without producing some sharp hip pain, whether that's pain in the hip or into the groin or even down the front of your thigh, then it's just too soon for this exercise program. My experience over the last 25 years definitely tells me that it's just too soon. So if it's causing sharp pain to that hip, then you just need to back up and just continue doing what your physical therapist most likely gave you. Continue doing those exercises for another week or two. Then you can come back to this program and see if you can perform those exercises without that sharp pain. I also want you to make sure that you stay within your doctor's restrictions. So hopefully you know your specific doctor's restrictions. One of the most common ones is they don't want you to bring that hip higher than a 90-degree angle. And if you've gone through this process, you know exactly what I'm talking about. So make sure that you know your doctor's restrictions and stay within those restrictions. The exercises that I have for you should allow you to stay within those restrictions, gain some strength, gain some balance and coordination, and get you back to just walking normally, going up and down stairs normally, being able to walk for prolonged periods of time, and sit and stand and just do all the things that you need to do at work, at home, or at play. So just view the 5 videos of exercises that I have following this video, and let's see if we just can't get you back to life as you used to know it.